Prevention and Control: Why Physician-Assisted Death Should Be Legal Nationwide. This is Brittany Maynard. Her and her husband Dan are celebrating being newlyweds and are ready to start to have a family. According to Death with Dignity, a national advocacy organization for end-of-life reform, Brittany was just 29 when she was diagnosed with a terminal brain cancer. Facing unbearable pain and having a declining quality of life, Brittany made the tough decision to leave her home in California and move to Oregon, where physician-assisted death was legal. Brittany became an advocate for the right to die with dignity and promoted legislation that would allow terminally ill patients to end their lives on their own terms. Brittany Maynard ended her life November 1st, 2014, after taking one last walk with her husband and 2 dogs. Later, ingesting the medication at home, falling into a deep sleep, peacefully passing by those who loved her the most. According to the legal policy website, legalclarity.org, physician-assisted death is only legal in 13 states. This interactive map on the Death with Dignity website shows what states are considering it and other states that have no legislation activity and where it's legal. Imagine you become terminally ill and you live in a state without physician-assisted death. You are now further burdened, just like Brittany, with the costly and painful ordeal of relocation for this medical option. Today, let's discuss physician-assisted death, explore the need for its legalization nationwide, propose a framework for its implementation, and understand the benefits of providing compassionate end-of-life choices. To truly grasp the solution, we must first examine the problem. Terminally ill patients often face a lack of autonomy and control over their end-of-life decisions. According to the Oregon Death with Dignity Act 2023 summary, the most commonly reported end-of-life concerns are as follows. Loss of personal autonomy, 92%. The decreased ability to participate in enjoyable activities, 88%. And loss of dignity, 64%. This highlights that the desire for physician-assisted death is often to retain control over their life rather than solely for pain relief. According to an online survey study by Lisa Kozloff, a clinical psychologist and assistant professor at Rutgers School of Public Health involving 3,227 people, over half were unsure if physician-assisted death was legal in the United States. 50.8% didn't know if it was legal in their own state. Although people in states where physician-assisted death is legal were more aware of its legality nationwide than those with not. Furthermore, 44% of all respondents said that they would consider using physician-assisted death as an option if they were diagnosed with a terminally ill condition. According to Lisa Kozloff, these results show a gap between those who desire this option and those who could actually use it if they were informed about it. In summary, terminally ill patients frequently experience a diminished sense of autonomy and control. The first survey highlights a notable gap between the desire for medical assistance in death and the actual availability and awareness of it, further limiting patient autonomy in making informed choices about their final days. Having identified the problem, let's turn our attention towards the solution. Physician-assisted death should be legalized across the nation. This would allow terminally ill, competent adults to request a prescription from their doctor to end their life. This process would include multiple requests and multiple physicians to confirm eligibility. Eligible patients would also have a prognosis of 6 months or less to live and would have to ingest the medication themselves. To ensure informed consent and prevent abuse, patients would also have to consent to undergoing a mental health test. According to the Oregon Health Authority, the Oregon Death with Dignity Act paved the way for similar legislation after its enactment in 1997, allowing terminally ill patients to require this prescription to peacefully pass, thus giving them autonomy over their final moments again. The 2023 Death with Dignity Act summary states 560 prescriptions were given out. 367 deaths resulted from ingesting the medication. That accounts for just 0.8% of all the deaths in Oregon. Physician-assisted death plays a critical role in end-of-life care. the successful implementation of the law in Oregon can serve as a model for its adoption throughout the United States. Now that we understand the solution, let's explore the benefits. This solution is beneficial in many ways. Nationwide adoption of this legislation would bring this compassionate medical option to all patients, granting them control over their end-of-life experience. Not only would this increase autonomy, it will also decrease suffering and improve end-of-life planning for the terminally ill. When patients have more options, they can make more clear decisions about hospice, family arrangements, and personal closure. Suffering isn't just physical. According to psychologist Melissa Henry from McGill University, end-of-life suffering also includes psychological, social, and existential fears. Having access to physician-assisted death can ease all those fears by giving them the control back in an extremely vulnerable time in their life. Consider physician-assisted death was legalized across the United States and available to all those who seek resolution in the face of a terminal illness. So, in conclusion, today we've addressed the problem that the terminally ill lack autonomy. The solution of legalizing physician-assisted death nationwide, along with its many benefits. Adoption of the solution means that you or a loved one will have the choice to peacefully pass with dignity when confronted with a terminal condition. Connect with your state representatives today, and let's make a change. Thank you, guys.